Good afternoon and welcome to this live interactive session of HIPAA training held on August 19th, 2020. Today's training will be facilitated by Janelle Moran, licensed clinical social worker and Mercy Haven's compliance officer and privacy officer. Janelle is your main point of contact for all of your HIPAA-related questions. We are going to open today's training with a video that we have selected which reviews some of the most important or key takeaways related to HIPAA. It is called HIPAA's Privacy Compliance. It's the law.
Healthcare is no stranger to any of us. Whether we are providing it or receiving it, confidentiality is paramount. Fortunately, there is a practice in place to protect us. In 1996, the Health Insurance Portability and Accountability Act was signed into law. The law, more commonly known as HIPAA, protects the privacy of every medical record and strengthens every individual's control of personal health records by giving us greater access to our personal health information and greater control of its use and disclosure. HIPAA has been updated several times over the years, including through the HITECH Act of 2009, which increased penalties for non-compliance and imposed stringent requirements for data breach, and through the final Omnibus Rule of 2013, which strengthened privacy protection to its greatest level yet. HIPAA is a rule that is important to all of us because we all have personal health information. Protecting this information is one of the most important duties of any healthcare professional. Not only because privacy is a sacred right that we all cherish, but also because it is federal law and is therefore mandatory. There are severe civil and criminal penalties for non-compliance. Anyone who obtains or discloses protected health information by deliberate neglect, for personal or commercial financial gain, or for any other malicious purpose may be subject to termination, demotion, suspension, hefty fines, loss of license, or criminal prosecution. Protected health information, also known as PHI, is health information that can be connected to a person. In other words, if any identifying information such as name, address, birth date, or social security number is connected to health information, then it is protected by HIPAA. Covered health information includes past, present, or future health conditions, how the health care was provided, the payment history for the health care, personal information such as name, address, social security number, birth date, and billing information. HIPAA covers the protection of this information when it is used or disclosed orally, written, or printed on paper, and when sent electronically. The best practice when dealing with health information is to automatically assume it is protected by HIPAA until you are told differently by an expert. Organizations covered by HIPAA are called covered entities. A covered entity is essentially any organization or individual who has access to patient records. These include healthcare providers, health plans, healthcare clearinghouses, and business associates. Business associates are organizations or individuals who provide services such as claims processing or legal and consulting services. A business associate is covered by HIPAA if their work involves access to protected health information or the use or disclosure of protected health information. When a covered entity hires a business associate, there must be written safeguards that detail PHI use. The business associate is subject to the same HIPAA rules as any other covered entity and cannot be contractually authorized to violate the rule. How is protected health information protected? In many cases, it requires written authorization from the patient or a patient's family to use or disclose PHI. However, HIPAA was never intended to get in the way of prompt and effective medical care. Consequently, there are several scenarios when this authorization is not required. When treating a patient, the full record of an individual's medical history is needed to provide the best care possible. Therefore, permission is not needed when PHI is accessed by professionals directly involved with the patient's medical.
Sorry, I don't know what just happened. where it was. Oh, sorry about that, guys.
Incidental exposure. In these
I don't know why I'm getting
goes PHI for healthcare operations and billing.
Not
Healthcare
hearing any
workers who
feedback.
receive PHI in these instances should make privacy their paramount concern and do everything in their power to keep the information private. There are some situations, however, where complete privacy is not possible. HIPAA calls this incidental exposure. In these situations, medical professionals should take reasonable care to keep information private. When discussing the treatment and care of a patient, try to avoid public areas like waiting rooms or elevators. If this is not possible, then avoid using the patient's name. If the patient is not in a private room, the curtain should be pulled and a reasonable attempt to not be overheard should be made. For instance, this doctor and nurse are discussing a patient as they walk down the hallway. However, they are taking care not to mention the patient's name and the hallway is not busy. They have minimized incidental exposure and are not in violation of HIPAA. When using PHI, healthcare workers should use the minimum amount of information necessary to get the job done. HIPAA calls this the minimum necessary rule. The doctors and nurses directly involved with the treatment of a patient need all of the medical history available for effective medical care. However, other workers involved in the care, such as lab technicians, need a much smaller amount of the patient's personal health information. Covered entities need to establish policies and procedures that restrict the access and use of PHI to the minimum necessary. Employees who regularly access PHI need to be categorized by the type of PHI they need and the conditions for their access, so that only the amount of information they need to do their job effectively is released. In addition to patient treatment, operations, and billing, there are several other scenarios where no permission is needed to release the minimum necessary PHI. These include for public health activities related to disease prevention and control, to report victims of abuse, neglect, or domestic violence, for audits, legal investigations, licensure, law enforcement purposes, and government functions, for coroners, medical examiners, funeral directors, tissue organ donations, and certain research purposes, when requested by employers for a work-related illness, injury, or medical surveillance to comply with OSHA, MSHA, or a similar state law, to avert a serious threat to health and safety, and as a limited data set where all personal identifiers have been stripped out.
Okay, I'm going to stop it here and keep us going. So some of the things that I want to review, I think the most important thing that they're talking about in the video has to do with protected health information. So protected health information is anything that is created, received, stored, or disclosed by a HIPAA-covered entity, which is us. We are a HIPAA-covered entity, or their business associate in relation to the delivery of healthcare services, healthcare operations, and payment for healthcare services. So health information becomes protected when it includes a patient identifier. And just one thing to kind of talk about business associates. So a business associate is really somebody that you may be working with, an outside vendor, things like that, who through their work with Mercy Haven now has access to PHI. So we just started working with a vendor who's storing our paper records. So that organization had to sign a business associate agreement with us that basically said they're not going to now take the information that are in our records and use it or release it. So that's a business associate, somebody that you're working with who through their work with you now has information that you have on our participants. Information becomes protected when there's an identifier that could be used to identify, contact, or locate a person. So some examples that I listed here have to do things like name, address, dates, other than year. So if somebody were to receive service on a certain date and that date can be linked to them, and then you also attach, let's say, somebody's mental health diagnosis, that would be considered PHI. Phone numbers, fax numbers, email addresses, social security numbers, medical record numbers, things like that. So health information plus patient identifier equals PHI. So that's a very important thing, because I think oftentimes people aren't sure what PHI would be. And as I said in the video, we should treat everything like it's protected health information, because the information that we have in our records, that we have on our participants, is things that we really want to protect. So the HIPAA privacy rule restricts the use and disclosure of PHI in all forms: oral, recorded, paper, and electronic. So it's not one or the other, you know, and I mentioned before, electronic is a big piece, and there was even the HITECH Act that really strengthened that. You know, we have to make sure that we're protecting information that's found on the computers, whether you've saved it in the computer. We do have a lot of protection for precision care, which is the electronic charting system that we use for patient information or participant information. You know, and so there's a lot of parameters, and I'm going to get into it in a little bit, to really make sure that anything that we're having on a computer is protected as well. So you're permitted to use and disclose PHI for treatment, payment, and healthcare operations, but it's important to keep in mind that that is with authorization from the participant. So one of the things that the woman was talking about in the video, and when they say that you can use PHI for treatment, payment, and healthcare operations, a lot of what they're talking about is we have information on our participant Johnny, and if I have to do billing on Johnny, I need to have that information that's in the record on him. We don't need an individual consent specifically for me in order for me to do the billing. If we have the information in Mercy Haven and somebody needs to use it for their job, they can access it, and we don't need individual authorization for every little detail of what we do. We do get authorization from the participant to be a part of our program and to utilize that information for things like treatment, payment, and healthcare operations. It's actually a part of the Notice of Privacy Practices. It's one of the areas that they sign. So, you know, I think that sometimes gets confusing when that term is stated, like you can use PHI for treatment, payment, healthcare operations, but it still has to be with authorization. And it's so we could do our work, not that we're releasing it to somebody else. Another big thing that comes up has to do with the minimum necessary rule. And, you know, to kind of relate this to Mercy Haven, you know, you can only use information that you need in order to do your job. So some of the examples that come up, let's say I'll use Greg's staff in maintenance. A maintenance worker needs to know that Johnny at 17 First, first place I'm thinking of, I have no idea if there's a Johnny there. They need to know that 17 First has an issue with plumbing and they have to go take care of it. They don't need to know that Johnny is having an increased symptom of his schizophrenia, or that he was just in the hospital. However, you know, there are times though where the maintenance worker needs to be told that Johnny's having a difficult time, and you know, if you have any issues, to please let us know. But again, you're not going into details. But if the maintenance worker could be put at risk because Johnny's been very violent lately, then maybe some information in order to protect safety would be needed, but not what his diagnosis is, the fact that he's been in the hospital, the fact that he didn't take his medication today, things like that. So we really need to minimize the information that we receive. If you don't need it, you shouldn't have it. You know, the same could be said for, I'll use Imran as an example. Imran doesn't need to know, you know, different people's diagnoses. It's not something that he needs for his job, so he shouldn't have that information. You know, the same could even be said for the CRs versus supported housing. If there's no reason for a CR staff member to know a diagnosis or something going on with the supported housing resident, then they don't need to have that. If there's some reason why they're going to be working with that person, or they might be the one getting the phone call for the emergency line, then they may need to know that. But so it's the minimum necessary in order to do your job. Even myself, if I'm not being brought in to consult about somebody, I don't need to know everything that's going on all the time. So that's one of the key things related to HIPAA, is that if you don't need to know, you shouldn't know. And even though you work for Mercy Haven, not every detail of somebody's record and their information is something you should have access to. Here's a whole list of things that the participants have a right to. You know, they have a right to receive a notice of privacy practices. That's that big document that you've seen at your own doctor's office that really goes through what it is that their information, how it will be protected, and also how it could be used. If they want their protected health information to be communicated by an alternate means, they have the right to do that. If they don't want to talk to you over the phone, but they want things through email, they can request that. They can request that their information be sent to a third party electronically. If they want information about their work with Mercy Haven to be sent through email to, let's say, their father, they can request that. They have the right to inspect, correct, and request and amend their protected health information. That one doesn't apply so much to us in the respect of, we're not necessarily diagnosing them. We do have some assessments that we would be doing it through Mercy Haven, but a lot of the information that we have specific to somebody's health information often is from somebody else. So we're not always in a position where that would come up. They have a right to request copies of their record, of their protected health information. And that has happened, where people want to see their documents and they need copies for various things. And that's all requests that would go through me. It's not something that people should be deciding on an individual basis. They have the right to request a history of non-routine disclosures. So when has their information been shared in a way that's not routine, in a way that is outside the normal business that we were doing? It happens sometimes when we have to respond to things like a grant request where they wanted to know, let's say, financial information about people living in the house. Well, those things are traceable back to the individual. So stuff like that, which is not often, but if we do have those routine disclosures, that's something that then I keep a record of in case somebody asks for it. They also have a right to have a history of disclosures related to their treatment, payment, and healthcare operations. So when the staff are writing progress notes about interactions with, or phone calls or disclosures with, let's say, somebody's clinic, that has to be documented because the person could ask for that information. They also can receive information on how they can contact myself, the privacy officer, or also the Department of Health and Human Services, because they could file a complaint if they chose to.
And with that, we are at our next video, and this video is entitled HIPAA Happens, Don't Let It Happen to You. This one is a little more fun, and we selected this video because this is real life. This is us. Maybe not to this exaggerated extent, but unknowingly or unwittingly saying something we should not say in an open forum, whether it's within earshot of another resident at the CRs or by the front desk at the main office. This happens and it's a breach, and it can create a liability for you as an individual as well as Mercy Haven as a whole. So let's watch.
Before we get started today with simulation, I'd like to cover HIPAA, the Health Insurance Portability and Accountability Act that was in place in 1996. This basically protects our patients from anybody coming in and violating privacy. There are sets of standards of how all protected health information should be controlled, and that is part of your job, controlling what you give out. This includes chart information, telephone calls, date of birth, name, of course, and HIPAA applies to all covered entities, anybody within the hospital setting, physicians, and as well as yourself. And how this is important today is that we would like you as students to keep.
Hey, Mom. Yeah, I had an off day today. I had Mrs. Gonzalez, our neighbor, as my patient. Yeah, she's an alcoholic. Yeah, she drinks a lot. Like, she was as yellow as a banana and throwing up all over the place. It smelled so bad. Yeah. Okay, I gotta go. I love you. Bye.
Who are you talking about?
Oh, my patient, Mrs. Gonzalez.
Marcia Gonzalez?
Yeah, who are you?
I'm her husband.
Oh.
Hey Nicole, how was your day? It was tiring. I mean, I had the worst patient on the 3rd floor in IMC. He had the worst code brown situation I've ever dealt with. Really? Like tarry poop everywhere. I stepped in it. It smelled so gross. I'm pretty sure I still smell.
Wait, are you talking about Mr. Jameson?
Yeah.
I think I had him yesterday.
Isn't it
was
awful?
so bad, but my day was so much worse. Yeah, family was just nagging
Are you talking
me.
about your patients in here? And you're saying their name. I'm the director of nursing here. Do you realize I overheard you? And you're breaking the HIPAA laws?
I'm sorry, we didn't know anybody else was in here.
Yeah. This and finish it up later.
It looks like they're...
Sweet, man, computers.
Yeah, I love Monopoly.
Yeah, let's get down to Monopoly. Whoa.
What's up?
I think these are patient files. Doesn't look like Monopoly.
No, it doesn't.
Well, this is Max's file, man.
No way.
Yeah, look at this. Yeah, I think he...
Dude, Max is pregnant.
When did Max start smoking?
It says 3 months after the pregnancy. Hey Max, dude, congratulations. I heard you're having a baby boy. You're not still smoking, are you?
Control the access, use, and disclosure of information, and to ensure patient privacy rights. Before we go any further into privacy rules, do we have any questions?
Okay, I'm gonna stop it here. So with that video that you just saw, there was a lot of things that were happening that we can identify as what they call a breach. So information that you let out or that you received that you shouldn't have is considered a breach. And they say all unauthorized acquisition, access, use, or disclosure of PHI is considered to be a breach. So, you know, that's an important thing because it's the idea when there's a breach that if there's a big risk that information fell into the wrong hands, that's when the penalties and the fines and the issues really come into play. So we put a lot of things in place to minimize the risk of breaches. So we have systems and agency policies that created to detect, correct, and prevent breaches. So some of those include audits. I do audits within the main office. You'll hear me talk about that. I go around and I check your offices to make sure you haven't left information on your desk, that the computers are in a way that nobody can stand behind you and see them when they're walking past, things like that. That's one way that we try to prevent breaches. Imran does a lot in terms of our IT system to safeguard access to our servers and the information that we have on our computers. So there's different like malware and antivirus software, email encryption, things like that. I started the next one about precision care only because during COVID, we took this away, but it is definitely going to be coming back, that only Mercy Haven IP addresses could access precision care. You know, that was always something that was really important, but given right now the need for some people to be working from home, that we did modify that slightly, but that will be coming back. Other things like we have the server room locked. We have the secure offsite storage facility for documentation that I spoke about before. We have computer password protection. We have to change a password. We have agency policies prohibiting the sharing of passwords. We have computer screen timeouts. We disabled the USB drives, and that's important. And I know it's always, even for myself, it slows us down sometimes when we're trying to do work. It becomes a barrier. But if I could download everything on my computer and bring it home, now I have access to things that potentially I shouldn't. And it increases the risk that somebody else besides myself could have access to that. So that's why that one's important. We do have encryption software. It's called 7-Zip that you really should be using when you're emailing PHI outside of Mercy Haven. And if you don't know what I'm talking about, I do have a guide that can explain how you can use it. And that's really, you are putting a password on the document, and then you have to let that person know that's receiving it what that password is. But if by some chance that email gets in the hands of somebody else, they can't open it because it's password protected. Another thing that we have is called Parallels, and it's an application that those that use like the iPads in supported housing, it's a way to access the network that's secure. It's like an extra layer of protection. So they can access the files that we have through the L drive, but they have to go through the secure network in order to do it. We also have an encrypted backup system for when data is transmitted and stored. So there's all these different things that we've put in place to try and prevent a breach from happening, prevent somebody from getting information on participants that they shouldn't. But at the end of the day, you know, human error can happen, and that's what, or just laziness or lack of really recognizing the need, as we saw in the video. So, you know, these are all things to definitely keep in mind. So who should you notify if you think a breach has occurred? So let's say you had a chart, you had paper information on somebody, and now you lost it and you don't know where it is. What are you supposed to do? Well, the first thing you need to do is you either need to tell your supervisor or you need to give me a call. And you need to do that as soon as possible, as soon as you think the breach has occurred, because maybe we can find it. Maybe it's not completely lost. And if it is lost, then it becomes my job to really make sure and figure out what it is that was released. Is it something that didn't really have a lot of information on it? There was no Medicaid numbers, there was no Social Security numbers. It was a diagnosis and an initial, and maybe we evaluate that it's not, the risk was low, and we can assess whether or not we think it's okay. And if it isn't okay, then there's a whole reporting structure that has to be done. But we must consider, did the information include patient identifiers? Who may have had unauthorized access to the exposed data? Was the data inappropriately viewed? Was the risk resolved quickly? So these are all things that, myself and others would have to consider, but we need to be notified as soon as possible. One of the things that happens is that the participant gets notified when their information is compromised. So when PHI has been compromised inside or outside the agency, and we have to let them know within 60 days of the breach. So there again, I can't say it enough, you need to let me know as soon as you think something is lost. And even if you think, well, it's tiny, it wasn't a big deal, I faxed something to the wrong number, whoops, no big deal. It is a big deal, and it could lead to fines for both the agency and yourself. So you really got to let me know. The Secretary of the U.S. Department of Health and Human Services must be notified of all breaches. So when we have a breach issue, I have to let them know. And then the media gets notified for breaches affecting 500 or more people. So unfortunately, there's been way too many breaches lately over the past couple of years that we've heard about. You go use your credit card at Target, and then we hear that all these different credit card numbers and Social Security numbers, whatever it may be, were hacked into, and people that shouldn't have had it got it. And the reason you're seeing it in the news isn't because these companies are being generous or it got leaked, is that they're responsible to let the media know and to let the individuals know. And then there's been a lot of class action lawsuits because of it. So, this does happen, and it's happening a lot more as technology becomes the way that people do business and shop and things like that. But like I said before, even down to the smallest things, we really have to make sure that we're protecting the information. So I've said significant fines and penalties for violations and non-compliance. Fines and penalties apply to covered entities, which is Mercy Haven, business associates, which is anybody that we're working with, subcontractors, and individuals. And the individuals being yourselves, the worker. Staff who break HIPAA laws under agency policies could face issues including termination, fines, and criminal prosecution. So this isn't a joke. This isn't something that, you sit here and you're like, oh yeah, I got my HIPAA training done, and then you forget about it. It is important because it can lead to a lot of big issues, both for the agency and yourself. And we do have access to information about individuals and information that somebody may use against them in a harmful way, like stealing somebody's Social Security number, stealing somebody's Medicaid number. So we do have to take this seriously. Any questions, Sue? Any questions in the chat?
Sorry, I was muted.
Okay. I was gonna say, are we all still there?
No questions in the chat.
Okay. So the last thing that we're gonna do is, I have another short video. This one is 6 common mistakes that people make surrounding HIPAA. So, again, trying to make it down to earth, make it relevant to you. And I think this one also does a good job of it because, as we look at HIPAA trainings and stuff like that, a lot of it goes much bigger into like the hospital setting and that kind of environment. But we, as I keep saying, we have access to information too, whether we've created it or we've received it, and we need to make sure that we're protecting it. But all right, so I'm gonna go back to sharing my screen, and we will do one more video, and then I'll take any questions you may have, and then that'll be it. All right.
Okay. Sounds good.
All righty.
About it. HIPAA compliance requires diligence. With penalties reaching over $1 million, it's crucial for practices to be aware of mistakes that could result in HIPAA violations. Don't worry, we're here to help. I'm Rachel from the Therapy Note Success Team. Today, we're going to cover 6 simple mistakes that could cost your practice tons in fines and the resources you'll need to learn how to handle them. Mistake number 1, a lost or stolen device. It's not uncommon to accidentally leave your phone or laptop behind. Maybe you hastily got out of an Uber or forgot your phone on the table as you left a restaurant. Perhaps your flash drive fell out of your pocket as you were digging for something else. Or even worse, maybe your device was stolen from your car. Whatever the case, you could have a breach on your hands if a device containing electronic protected health information or ePHI, is no longer secure. The situation becomes even more severe if the device contains unencrypted ePHI. According to the Office of Civil Rights, any loss of control over unencrypted ePHI constitutes a breach. So how do you protect yourself against a breach resulting from a lost or stolen device? We recommend you avoid storing ePHI on mobile devices. Regardless of the device it is contained on, ePHI should always be stored in a secure location and encrypted, which involves encoding the information in such a way that only authorized parties have access to it. Many devices have encryption capabilities built in, so take advantage of these capabilities to encrypt any files and folders that contain ePHI. And be sure that any device that you use to store or access ePHI is further secured with a strong password and configured with a screen locking setting that requires your password to be re-entered after inactivity. Mistake number 2, improper storage or disposal of records. Proper storage and disposal of PHI is essential, regardless of whether your records are kept on paper or electronically. Any document containing PHI must be stored in a secured location at all times and kept out of sight from unauthorized parties. Special care must also be taken when destroying records. Simply deleting a file does not sufficiently erase it from your hard drive, and throwing a crumpled up document in the trash doesn't protect the information from unauthorized parties. All staff members should be trained on both the proper storage and the proper disposal of PHI to ensure that your records don't end up in the wrong hands. Mistake number 3, unauthorized disclosure of information. Disclosing PHI without authorization is one of the most common mistakes a provider can make. Talking with a friend about a mutual acquaintance under your care, discussing a patient with staff at the front desk, and even accidentally filing a document containing PHI in the wrong patient's chart could put you at risk for a breach. Sending PHI to the wrong recipient, even if it's accidental, is also a violation. PHI should only ever be discussed in private settings with the people who need to know. All practice staff should be instructed to never discuss PHI in an open setting, and always verify that information is only being made available to an authorized recipient. Mistake number 4, lack of a business associate agreement. One of the more difficult tasks for providers is determining who qualifies as a business associate and securing a relationship with a business associate agreement, or a BAA for short. A BAA helps to ensure that a business associate, such as your EMR vendor or telehealth service provider, will appropriately safeguard PHI. Even if both entities are trustworthy and in compliance with HIPAA, a BAA that clarifies the permissible uses and disclosures of PHI with an entity who helps you conduct business is required. Failure to execute a BAA could result in a hefty fine or make your organization liable for any breaches by the business associate. Mistake number 5, inadequate risk analysis policies and procedures. Taking time to examine where a breach can occur in your organization and documenting your policy for that situation can be important for protecting yourself. For instance, you may need an electronic media policy that details how devices should be encrypted and what safeguards and access controls should be implemented. Policies should enumerate who has access to PHI, how it is to be used, and what steps to take in the event of a breach. However, simply writing these policies isn't sufficient. Your policies must also be followed daily and reviewed and updated regularly. Impress upon your staff the importance of following established policies and encourage them to point out potential violations. As your practice grows and changes, there may need to be different ways of handling PHI and updates to the BAAs you already have in place. And lastly, mistake number 6, sharing usernames and passwords. According to the HIPAA security standards, assigning each staff member who accesses PHI a unique user identifier is a required technical safeguard. Unique login information for management systems, such as your EMR, gives you the ability to identify and track user activities and form an accurate audit trail, which is a key component of the HIPAA security rule. Staff members should never share usernames and passwords to access PHI. Doing so not only directly violates HIPAA, but also undermines your efforts to maintain HIPAA compliance by putting you at risk for other violations, such as unauthorized access to information and a lack of access controls. In most cases, avoiding HIPAA violations involves common sense and some careful attention. However, many seemingly harmless actions could land you in a breach situation. Keep all staff in your organization educated and up to date on HIPAA regulations, and take advantage of the training materials offered by the HHS. If you do experience a breach of unsecured PHI, be sure to issue a notification of breach in accordance with the HIPAA breach notification rule.
A couple things I just want to, say before we wrap up. We have a tremendous amount of policies in our agency related to HIPAA. I did not create them. They were created by a law firm who really, digested every detail of the law and, provided us with guidance and these documents in order to make sure that we had what we needed in place. It's a thick book. And they should be in everybody's department, accessible to anybody that wants to see them. So, I say out loud that you are all responsible for following those policies. Even if you've never read it, you are responsible for following those policies. So I do encourage people to take that information and look at it. I did also create a summary page, it's about 3 pages long, of each policy, giving you a snapshot of what's in the policy. Because if a question comes up and you're not sure how to handle it, by going through the policy book or even going through the summary page, it'll guide you on what to do. And they're individual specific, meaning they're for all employees, they're for the supervisors, things like that. So, and for the privacy officer on how to handle certain things. I refer to them myself when somebody comes with a question, and I'm encouraging you to do the same, because they're there for your knowledge and we're all being held to that. So, just know that that's there. There's also the steps on how to do the 7-zip encryption within that summary packet as well. So, it is a useful tool. Just to highlight again, minimum necessary is so important. Not talking about individuals in public spaces is so important. The front desk does not need to know about your bad day because, somebody is having symptoms and who they are and what they're going through, like all those kind of things. We really have to have respect for, individuals' privacy, especially when it comes to their health information. What are some things that we heard today that were important, whether it's review or it's new?
We'll just take a moment here to give everyone an opportunity to put their ideas in the chat box.
Not to leave computers unattended, good. Do not text information, thank you. Giving or having only need to know information, great. Keep information confidential. Don't talk about people in spaces where others are around and can overhear the mistakes. Provided a reminder, great. Never using safe passwords on desktops. To call providers at all times and not to text information from Lisa. If we don't need the information to do our job, then we don't need it. Great. Don't share passwords. Don't debrief with everyone you meet. Fantastic. And personal liability. Yeah. This is not just about Mercy Haven. This is about you guys as well. Okay. Well, I thank you all for typing in some information. It just shows me that you heard something. I'm available. If questions come up, please don't hesitate to ask. It's like the idea of compliance that I always say. I'd much rather deal with it and we can address it than hide something and then I have to figure it out later and then it becomes a much bigger issue. So, being open and honest, like if information was released and breached, let us deal with it, as opposed to, during an audit, I find out that we haven't updated authorizations in years, or authorizations were thrown out or something like that. Those kind of things. If you find something that's a problem and it's related to HIPAA, please let me know. Well, I thank you all. This was, again, my first Zoom training, and I guess it went okay.
It's a great job, Janelle. On behalf of everyone who attended today, thank you so much. And for those of you who are attending a recorded version of this training, to get credit, please make sure you sign the attestation and return it to Human Resources along with your HIPAA privacy post-training test. Both of these items can be found on the employee portal. Thank you.